Good afternoon, everyone. It's 12 o'clock. My name is Tim Senior. I'm joining you here from the Asthma Australia Facebook page for a live video talking about COVID-19 and access to general practice. I'll say a little bit about who I am in a second, but first of all, I'd just like to acknowledge the traditional country that I'm on at the moment, Tharawal country, which is southwest of Sydney. I live and work on Tharawal land, and I'd like to acknowledge the elders past and present and emerging who've looked after this land for many thousands of years. I'd also like to acknowledge all the lands that you come off from across Australia too. So my name's Tim Senior. I'm a general practitioner. I actually work at the Aboriginal Medical Service in Campbelltown, southwest of Sydney. And I serve on the Professional Advisory Council for Asthma Australia. So I'm here to answer all your GP questions. And I'd also like to thank Lauren and Teresa, who are joining online from the Asthma Australia, all working from home, and they're based in Brisbane, I gather. So thank you to them for hosting as well. These are anxious times for everyone, and I think things are changing so quickly at the moment that it's hard for us to get to grips with what's happening. And so it's good to have as much good information as we possibly can. And so I thought I'd just start by saying that the advice for people with asthma is essentially the same as it is for the broader community. And so we've got all the advice that we know and we've been hearing that's so important. So just to recap that, social distancing is really important. And they call it social distancing, but actually say that social connection, but physical distancing is really important because we do need to look out for each other and stay in contact with each other by phone, by internet as much as we can, but keep our distance. And that distance is 1.5 meters in Australia. That's the advice, at least 1.5 meters. I was speaking to my parents in the UK the other day, and they said that in some of the country areas of England, they've advised to keep the length of a cow apart from each other. So I thought that was quite a helpful way of doing it. Other really important things are to wash your hands with soap and water regularly. And they say do that for at least 20 seconds. And you can use hand sanitizer. Soap and water is actually just as effective as hand sanitizer, but obviously slightly less portable. The cough and sneeze etiquette is cough or sneeze into a tissue and then throw it away. Or if you don't have tissues to hand, onto the inside of your elbow like that. The recommendation is not to touch your face. Now, I find that really, really hard, and I'm sure that you'll find me touching my face a few times during this Facebook Live session. But as much as possible, that's a way of preventing the infection. It's spread by droplets from coughing and sneezing, hence the distances are really important. If you're unwell, like feeling that you've got fevers or cough, the best thing to do is not to go out. And some of the simplest advice I've seen is actually some of the best advice I've seen is actually act as if you have the infection. And so I'm seeing some people commenting at the moment that because of their severe asthma due to a chest infection, they're staying home. And I think that's actually a really good idea. Thanks, Julie, for that. I think that's a really good idea, and to let people know that that's what you're doing. One of the important things about this is that doing that, you've probably all seen graphs about flattening the curve, that doing that is one of the ways of not spreading the infection so everyone gets it all at once. And so we delay the spread through the community. So it's actually a really important way of looking out for each other and looking after each other. So even if we may not be especially vulnerable, there are other people in our communities who may be more vulnerable. And this is a way of looking after them. So welcome to all those who are joining us. My name is Tim Senior, GP doing this Facebook Live session. We've got a few people joining us who are asking about the availability of inhalers at the pharmacy. And I think that's a real anxiety for people with asthma at the moment. Now, my understanding is Asthma Australia will also be doing another Facebook Live session with a pharmacist, I think later this week. And so that'll be a really good opportunity to to join and ask the pharmacist that question about how they're doing that. At the moment, the restriction is to not dispense more than a month's supply of a number of medications, including asthma medications. And the reason for that is that initially there were lots of people who didn't have asthma who were actually getting inhalers, and so they weren't as available for people with asthma, and it's going to be really important that people with asthma do have access to it. So certainly on Friday I was phoned by the pharmacist just to confirm that the person going to the pharmacy for inhalers did actually have asthma, and so I was able to confirm that on the phone. So pharmacists that you see may well ask you for confirmation that you have asthma, and so they may give the doctor a ring, and it's possible that that some practices will say, yes, we can give you a letter just confirming that you have asthma to make the access to your inhalers as easy as possible. So someone's asking here that they have, Jojo, thank you for your question, thinking if they have a bad attack and can't get medication, don't want to go to hospital or call an ambulance. I think that's completely understandable. And I think one of the important things there will be to know your asthma well and the sorts of things that trigger it, and do, where possible, to avoid the things that trigger our asthma, to make sure we have a supply of our medications at home, particularly if we're on preventer medications, to have those available and to be using those. Worth having your asthma action plan up to date, and that's a way of outlining exactly what it is to do if your asthma is getting more severe, so that hopefully we can head it off so we don't need to go to hospital or call an ambulance. And I think the most important thing with that is that if you do get sick enough to need to do that, then don't hold back. If you need emergency care, then it's still important to get that if you need it. But as much as we can, yourselves and your GPs will work to prevent that from happening. So I was asking, are there any statistics on asthmatics who have COVID? It's a really good, important, thank you, Milena. That's a really good, really important question. And I think it's worth acknowledging there's so much uncertainty around. We're all trying to gather reliable information from a large number of sources. Now, my understanding is on the statistics I've seen, mostly coming out of China, they say people with chronic respiratory conditions are at higher risk from from COVID-19, sorry. When you look at the age groups for that, most of those are older people who've had severe outcomes from COVID-19 rather than younger people. So they've grouped together all people with all sorts of chronic respiratory illnesses. So that would include chronic obstructive airways disease, such as chronic bronchitis or emphysema. That would include people with bronchiectasis or even cystic fibrosis, but it would include people with asthma. Now, my understanding of those statistics is that it's likely that it's those other chronic respiratory conditions that are more severely affected, asthma to some extent, but many people with asthma are in those younger age groups, where we didn't see huge amounts. So while I think people with asthma, the risk isn't zero, I don't think we need to worry unduly that the risk is particularly high. There may well be some, that's in general. I think the people, the advice that I've seen coming through is to be especially careful with your social distancing for people who have more severe asthma, including those who are on high dose inhaled steroids. So that would be the higher doses of things like Flixotide to prevent their asthma. And those who might be on biological agents which suppress the immune system. It doesn't mean you're definitely going to get COVID, and it doesn't mean you're definitely going to have a severe version of COVID, but those people would probably need to take a good deal of care. I'm just looking through at some of the other questions and comments coming through. Again, someone's asking, thank you for your question, Kylie. My 9-year-old currently has mycoplasma pneumonia. How seriously would the virus affect him if he was to get it? That's a really good question. It's difficult to answer. One of the things is that children, while they can be affected, it looks like their illness from COVID-19 is much less severe than it is in older people. Having said that, people with mycoplasma pneumonia is a particular sort of pneumonia that can be a little bit more difficult to treat, but it is entirely treatable. And people with other lung infections may be slightly more vulnerable. So I think in that scenario, Kylie, that's worth checking out with your own GP. But I suspect that the fact that he's young is protective. The fact that he's got another infection going on means during that infection, it's worth being a little bit extra careful. Someone, Nat, thank you for your question. Just to clarify, ventolin is not a possible treatment for COVID. That's correct. So ventolin it's called a bronchodilator, and what it does is it opens up the tubes to your lungs very quickly, which is why it works well in asthma. It's not a treatment for COVID-19. It's possible that people with asthma who get COVID-19 have an exacerbation of their asthma, in which case the Ventolin would be useful at treating the exacerbation of their asthma, but it wouldn't be particularly effective at treating the COVID-19 or the pneumonia that results from COVID-19. A good question here from I'm afraid I can't pronounce your name. Kumfin, it might just be your Facebook name. It's a very good question. Should anyone be taking dexamethasone if COVID is detected? So dexamethasone is one of the steroid treatments that's sometimes used. Other steroid treatments would be prednisolone is the most common one, or prednisone, and hydrocortisone might be another one. This has been a big discussion. It looks like people who have severe COVID, steroid hasn't helped them and perhaps has hindered their recovery. And I gather that in intensive care, they're not using steroids as part of the treatment for COVID. For those people who are on oral steroid, not inhaled steroid, it's unclear what the effect on COVID will be. To some extent, that will lower the immune system, and so I think caution is advisable, and the normal social distancing and preventing measures would be important. But I would not, if you're on steroid, I wouldn't stop taking it just because of COVID-19. Thoughts of stopping steroid, if you've been on steroid for a while, often that needs to be stepped down gradually, because you can actually get side effects if you've been on it, only if you've been on it a while, from stopping suddenly. That would be a good question to go and see your GP. Again, so biological medicine does suppress the immune system. I was talking about this with some of my patients last week, because I think this is a real issue. It does suppress the immune system. The people I think are most at risk are those who are on immunosuppressants, for example, or are immunosuppressed as a result of chemotherapy for cancer, and they would be fairly high risk. And people who are on immunosuppression following transplants, they would be fairly high risk. Slightly lower than that would be people who are on biologic agents for asthma and for autoimmune conditions. Possibly slightly lower than that, or alongside that, would be people on high-dose systemic oral steroid medication. And so that would be the way I would rank them. It's such a rapidly evolving situation that I think that's based more on intuition about the medications rather than particular evidence that we've got about the effect of COVID-19 on people. Good question from Christine here. I was seeing that advice this morning. The UK has suggested 12 weeks isolation for people on high use of steroids. Would you suggest measures like this? And Christine says she's working in healthcare. It's a really good question, and I was thinking about this. I'm not sure what the evidence they're drawing on for that is. I think if in doubt, isolate, I think is good advice. Working in healthcare, I think be very careful about using your personal protective equipment and minimizing exposure to COVID. I'm not clear of the evidence on which they're basing that recommendation, though. I haven't seen that it's a particular recommendation that's widely out there. So I haven't seen that being suggested in Australia yet. I'm aware that the UK has a larger number of cases than we do at the moment, and they're slightly ahead of us in their lockdown. Great question from Anita Healy. Any statistics about children with tracheomalacia or laryngomalacia? So those are conditions where in young children, they're born with slightly abnormal trachea, windpipe, or larynx, the voice box. And I haven't seen any statistics about the effect on those at all. Again, they're probably protected by being young, but they may, but having a respiratory condition may increase their risk compared to other children. But I haven't seen any specific information on that. Just seeing the other comments come through. The other thing I think it is, it's 12:15. For those of us just joining now, welcome. This is Asthma Australia Facebook Live. My name's Tim Senior. I'm a GP, general practitioner who works in Southwest Sydney, and I'm on the Professional Advisory Council for Asthma Australia. Just looking at some of the other questions coming through. One of the things I did want to mention is that many GPs and other healthcare professionals are just getting across the announcements made yesterday that came in at 8 a.m. this morning. Medicare is now rebating telehealth across the board. So you can have routine consultations, you can have GP management plans and team care arrangements, you can see allied health, psychology specialists, all via telehealth. So either videoing or telephoning. The telehealth consultations have to be bulk billed, so you won't be charged a co-payment for that. Sometimes it'll be necessary to have face-to-face consultations. For example, it's impossible to give an immunization like the flu vaccine when you're over the phone. And so sometimes you will have to see a GP, but you'll all be able to take advantage of the telehealth. So contacting your GPs for and other health professionals for how they're going to manage that, I think will be important, because we're all getting to grips with the new regulations. It's coming very quickly, so different practices will be getting to grips with that right now. Just looking through some of the other comments. Thank you very much for all your questions. This is really good. Is my daughter at higher risk? She got half her lung removed due to cancer, so she has 80% lung function. Thank you for that question, Stephanie. These are, I think these are really anxious times for all of us, and particularly sort of with the uncertainty around that. And so I can imagine how anxious that must be, having gone through that and then seeing COVID-19 hit us. Again, she'll be protected by her age. Children don't seem to get not exclusively, but in the main get a very mild version of COVID-19. She has got, I would imagine that because she's had half a lung removed, she's got less lung there. So I think she would need to be more cautious. And the other thing is, if she's on any immunosuppression following the cancer, that would also affect her too. I don't know your precise situation. Someone's asking which steroids for asthma I'm on, Seretide and Spiriva. That's a really good question. The medications for asthma, there's and with other medications too, there's a lot of brand names, and then there's a lot of the names of the medication. Often you'll see the brand name like Seretide, and then in smaller writing underneath you'll see the name of the medication in that. And Seretide has 2 ingredients in. One of those is fluticasone, which is the same ingredient as in Flixitide. That's a steroid medication, and it comes in different doses, both in the Flixitide version and in the Seretide version. So you'll see it may be 50, 100, 250 micrograms. And Spiriva is a medication that works in a different way, another preventer medication called, and the name you'll see in small writing under that is tiotropium. And that's the same group of drugs as other ones, often ending in opium, not related to opium, I should add, but such as Atrovent, which is ipratropium. Now, so there's no steroid in that one. Again, there have been some indications from the UK about people on Spiriva having to be careful, but I don't know the evidence that that's based on. So I'd keep an eye on the information from Asthma Australia for that one. Good question from Kerry here. Can scripts be faxed through to the chemists? Yes, most practices are able to do that. And the process, check with your pharmacy and with your practice what their processes are. Most practices can fax a prescription through to the pharmacy and then they send the original through the mail. I have heard of some cases where that's not quite worked. I think all our systems are going to be put under pressure by everything being done in a new way, but that can certainly be done, and there should be arrangements for that. Again, just to clarify Tracy's question, a lot of people worried about what's happening with the supply of Ventolin. Do you need a script? Pharmacists are being asked to confirm that people do have asthma if they're requesting Ventolin. So sometimes that'll be done by requesting a script. Sometimes that's being done by contacting the GP in some way to say that that they do have asthma. Someone commenting that they used 13 Health on Saturday and the nurse was wonderful and helped to reduce my anxiety. Thank you, Julie. I think it's really important acknowledging that while the focus for us today is asthma and COVID-19, many of us will have other medical conditions going on at the time, and many of us will have mental health problems going on at the same time. And I think it's really important to discuss the whole range of that with your GP. And even if it's not a mental health problem, we're all feeling a lot more anxious at these times because it's really uncertain. It's really hard to plan what we're doing the weekend ahead, let alone sort of a few months ahead. So I think it's, if you have questions of your health professionals, do ask them, and sort of, if it's not quite clear, ask them to explain things, because that just even having things explained can really settle down our anxiety about this. So looking for big fear is knowing if it's asthma or COVID-19, 56 and have other health problems. Thanks, Karen. This is a really important question. And I think if you have access online, Health Direct has a symptom checker for COVID-19. The key feature for COVID-19 is actually feeling fevers and shortness of breath. Would be the two things I'm looking out for. So you may feel short of breath with asthma, but you won't have, like, the fevers would be more an indication of something infective, and short of breath can go with both conditions, but you may not feel quite as tight in the chest with the COVID-19. If in doubt, do give your GP a ring and see what advice they have. Because I think that's going to be important. Just reading some other. Thank you so much for all your, by the way. It's really, it really makes these sessions, when we feel that we're, even though we're distant from each other across the country, we're actually able to connect through things like this. And I think the other thing is that very often GPs like myself know, and specialists and pharmacists know about the sorts of things that work in asthma and the sorts of things that we're being told the evidence shows on COVID-19. But you do know your own asthma. And so I think it's worth trusting your gut instincts on that, and checking if you're in doubt with healthcare practitioners. It's management is much more effective when we're working in partnership with each other rather than just being told what to do, because you will know your own asthma and how it feels and the sorts of things that trigger it. And so I think that's worth remembering. Someone asking about vocal cord dysfunction. Kath has both vocal cord dysfunction and asthma, finding both difficult to deal with. That's a really good question. I haven't seen any specific information. I think the most important thing will be managing that in the usual way that you manage that, making sure that your asthma is managed well and your asthma action plan is up to date. And then on top of that, and almost separate to that, practicing the good social isolation. There may not be anything else particularly that you need to do regarding that. The questions are coming thick and fast, which is fantastic. And I do apologize if you are asking a question and I haven't got to it. Had an asthma attack last Thursday. This from Sharon. How long should symptoms last? I doubled my daily preventer, but how long do I continue at the higher dose? It's a good question. I'm reluctant to give specific clinical advice online because I don't know your medical history. So do check that with your GP. Often preventers take a bit of time to kick in. And it's worth taking them for several months to protect against future exacerbations of asthma. So I probably, particularly given the situation at the moment, I probably wouldn't be, if it was my decision, I probably wouldn't be too quick in discontinuing my preventer, but do keep an eye on your symptoms. The other thing that I would say as well is to recommend the flu vaccination. I think there are already some private supplies of the flu vaccination of this year coming out. So you may see that in pharmacists and some general practices. Early to mid-April, so that's this week, possibly next week, the government supplies of influenza vaccination are coming out. I think it's going to be really important to have that this year because the last thing we need is to have people infected with both COVID and influenza. They are separate viruses, and we don't know the effect. A lot of what we're learning about from China and from other countries affected the Northern Hemisphere are coming into their summer, and we're coming into flu season now. So I think it's going to be important to do that to protect ourselves from getting both infections. So again, speak to your GP about that. Do I have any recommendations for allied workers with asthma in the community health setting? Worth speaking to your employer about that. The recommendation would be to practice, to make sure your asthma is well controlled and do the things that you do to control your asthma as well as possible, including your medications and asthma action plan, and then to practice good physical distancing as far as possible in the healthcare settings, screening people for questions that might suggest a COVID-19 infection like fever and cough, and where possible, and again, this depends very much on your employer, using personal protective equipment. It's worth knowing masks don't protect people particularly, but they are recommended for healthcare providers because we tend to have collections of people in our services coughing. So the recommendation is actually to save masks for your healthcare professionals. Flu vaccine, when is the best time to have it? That's a really good question. One of the reasons for asking that is that the flu vaccine is at its peak for about 3 or 4 months, and then the immunity tends to wane. So the recommendation is to have one probably April, maybe May. That's the general recommendation each year. This year, I suspect it's worth having as early as possible. Now, some health professionals suggest having another one, say 4 months afterwards, to protect right through the flu season. That's not provided on the National Immunisation Programme or on state immunisation programmes. So if there's a second one, you may well have to pay for that. Some health practitioners will recommend that. There's no good evidence either way on which to make that judgment. So it tends to be a bit of an intuition call. The most important thing is actually to have it whenever is possible. I heard something about not using prednisone. I think if you need prednisone for an exacerbation of your asthma, then that's worth using, because the last thing you need is for your asthma to get worse and worse and end up in hospital. The concerns that I've seen around steroids, such as prednisone, are actually for people with severe COVID-19 in hospital and in or likely to need intensive care, which is a much more severe end of the illness. And we know we can stop that from happening for your asthma with steroid. So I think I'd say cautiously use it if you need to. We're always really cautious about steroid because they do have side effects. We try to minimize the dose people need, and we try to minimize the length of time that people are on, not for COVID-19 reasons, just for general reasons, that you don't want to be on steroids more than you need to. And for someone who is requiring steroids for their asthma, I'd be scratching my head and working with them to see if we can prevent it becoming that severe. I'm aware of the time. It's 12:31. That has gone very quickly indeed. Everyone has had, I'm really thrilled at the questions that have been coming in. They've been really excellent questions. A good question from Kerry. I've had my flu vaccine. Will I require another one later in the season, especially if the flu mutates? It doesn't tend to mutate that quickly over a single season. It mutates a little bit, which is why the flu vaccine is different from year to year. So it will be a slightly different flu vaccine that we get next year. But this flu vaccine will protect you through for this season. The reason for having another one may well be that your immunity from the vaccine wanes a little bit over the year. You retain some, but it just does tail off a little bit. And so some practitioners recommend having a second vaccine later on in the year. As I said, there's no strong evidence either way on that one. It's 12:30. Thank you so much for joining us for this Facebook live stream. I hope all the technology worked for you. I hope I've been able to answer your questions coming through. They came through thick and fast. I do wish you all well. Any doubts, do contact your own GP. Telehealth is available now. Your GPs really do want to, and other health professionals too, your nurses, allied health, Aboriginal health workers, they really do want to work with you to keep you well and keep you out of hospital. We know for all of us, these are really anxious times. And so I think staying up to date with reliable information as much as we can and looking out for each other and looking after each other and being kind to each other, and particularly those of us who might be more vulnerable, is going to be really important at times such as these. Thank you very much, everyone. It's been a pleasure getting to know you electronically, and have a good rest of Monday and a good week. Thank you very much.